Welcome to Benchmark Education Solutions, the trusted name in OET training. We have been giving expert guidance successfully to OET candidates for the past decade online through edubenchmark.com. Today we are going to focus on case note selection for OET Writing. In your OET Writing subtest, you will need to write a letter based on case notes given. You will be given 5 minutes as reading time and 40 minutes to write your letter. Time is precious. In order to get a good grade in your test, you will need to select relevant case notes, then organize them logically, and finally transform them into proper sentences. Before we go further, if you need any support with your OET preparations, you can check out some of the benchmark offerings. The most important step is the first step. You must select the relevant notes. In today's lesson, we will examine how you can do this. Before you even read the case notes, you should read the task. Find out what is required of you. It is crucial that you find out who you are writing to. Are you writing to a community nurse, to a doctor, or in this example, to a psychiatrist? Next, you need to be very sure about what you want the recipient of the letter to do. In this example, you want the psychiatrist to assess the patient. When selecting the relevant notes, you really need to think carefully. In this example we have given you, put yourself in the shoes of Dr. James Smith, the psychiatrist, and think about what type of information he would need to know to do his job. Of course, he would need to know what the main problem is, or what we call the chief complaint. He needs to know the current condition of the patient and where the patient is now. For a psychiatrist, social factors are important, so those notes are relevant. However, if you are writing to a surgeon, social factors may not be relevant. Do you see how important it is now that you always write with the reader in mind? Apart from knowing what to include, you need to know what not to put in your letter. For instance, in our example, does a psychiatrist need to know about the patient's father's medical history? Probably not, unless something about that affected the patient's state of mind, but this is unlikely. Here are some tips to sum it up for you. Think about the usefulness of the case notes to the reader. ask if the notes are actionable and if they have any bearing to the tasks to be performed by the reader. Now that you have identified the case notes, you can move to step 2. It is logical to organize your notes in order of importance. Let's take an example of a letter to a neurologist who will attend to a patient in the emergency department. Assume that the background of this letter is that the patient fell down at home due to a severe headache and was injured. Here is how you should organize your notes. Always start with the purpose of the letter, or you may lose marks. Also, in general, when someone is reading a letter, they prefer knowing the purpose of the letter immediately. Here, in this example, it is that the patient requires urgent assessment and management. You should also include the chief complaint. For instance, here, it is that the patient is displaying symptoms of space-occupying lesion. The next paragraph, also called body paragraph 1, should describe what happened to the patient. This is where you enlighten the reader about the recent situation, such as the patient falling at home, the injuries as a result of the fall, etc. In the second body paragraph, give more details about the main issue, or what is referred to as current medical history. This should include any symptoms related to the chief complaint, such as headache and nausea. It should also include information about assessment, management and tests which have already been done. Then in the third body paragraph, describe any secondary issue or past medical history if relevant. The final paragraph should discuss a plan going forward. Sometimes the final paragraph can include an expansion of purpose, although this is more relevant in letters to nurses, where ongoing care and support for the patient may be required. Take note that there are other ways to organize your notes. Here is a variation which you can also consider. This way is more common for a situation which may not have an urgency associated with it, and visits to the medical center are involved. The approach is similar to the first structure we have already explained because it starts and ends the same way. The only difference is that the most recent situation, or also known as current condition, is written last in paragraph 5, whereas in the first structure we suggested, the recent situation is described early in the letter in paragraph 2. Let's move on to step 3. Now you are ready to write the letter. You will need to transform the case notes into proper sentences suitable for the official letter genre. You need to remember these 4 points. First, write complete sentences. Do not use note form like in the case notes. Now, have a look at these 2 example sentences and check which one is more accurate. Next, you will need to demonstrate a good grasp of the language by using a combination of compound and complex sentences. Try to merge a few case notes into one sentence. For example, you can write, Panadol was given and rest was advised. Similarly, you can show contrast or unexpected actions by using words like although, but please note that a comma is not necessary after the word although. In the third example, we show you how to use the words due to in a problem-solution sentence. The problem was rapid blood loss, and the solution was the transfusion. You will also need to link your ideas coherently. One piece of information should flow logically to the next, like in this example. Some more examples of transitions are as a result, also, as well as this, apart from this. Finally, proofread your letter. For instance, what is wrong here? Yes, you are right. It should be he and not she in the second sentence. Our experience as one of the largest online OET writing correction service providers suggests that getting the gender wrong is one of the most common mistakes, something which can be easily fixed with careful proofreading. It is not easy to accomplish all that in 40 minutes. You will need to practice writing some letters before you sit for the OET test. Make sure you are writing well and not just writing over and over again in the wrong way. That is why writing correction is so important, because it will put you on the right track. We hope you liked this video tutorial. For more such videos, please press the like button and subscribe to our YouTube channel. All the best to you. If you need any help, we offer these services which many OET candidates before you have benefited from.